Good afternoon and welcome to Coffee with Casey, my live Medicare training series that I hold every Wednesday at 3 p.m. Eastern Time. Let me start with this. Some of the biggest Medicare challenges that I see, they don't come from bad decisions. They come from decisions that felt perfectly fine at the time. People enrolled on time, seemed simple, everything looked like it made sense, and then something changed. And that's what we're here to talk about today. And this is Coffee with Casey, so grab your coffee or your favorite beverage and let's get into it. For those of you who don't know me, my name is Casey Album. My family has been helping people navigate Medicare for nearly 30 years. Not only here in Florida where we're based, but all throughout the country. We've helped literally thousands of people over that time. And one thing I hear all the time is this: I didn't realize how all of this worked until it was too late to change. Before we talk, most people feel like they're doing the right thing, but they don't always see how things play out over time. Many of my clients refer to me as their Medicare co-pilot, not just because I'm a pilot. If you follow me on Facebook, you know that I am, but because I help map this out with them, just like I plan a flight, and then I'm right here with them every step of the way, at enrollment, when things change, and even years down the road when questions come up. My clients aren't guessing because they've got a plan. So if you've been following along, over the last couple of weeks, we've talked about the 5 common Medicare myths that trip people up, the 3 decisions that shape everything, and then how timing, structure, and costs all work together. Today, we're bringing that all to real life. We're going to talk about why some plans feel fine early on, but don't always hold up later. And this is one of those conversations that's going to give you perspective, not pressure. So if you're ready, write go in the comments. When you first enroll, a lot of plans can feel like they're working well, and that's because you may not be using them much. The costs seem predictable, and everything seems fairly straightforward, and based on that, it's really easy to feel confident in the decision that you made. But here's the reality. You're not seeing how that plan performs yet. A plan can feel great before it's ever truly tested. Write yes in the comments if that makes sense. So over time, things will change. But by then, it might be too late for you to change. And this is where I want to share a quick story. I recently spoke to a couple here in Florida. Not my clients. They were referred to me because they needed help. They had both signed up for Medicare Advantage at 65. The husband, a few years later, developed a really serious pulmonary condition. His doctors were all telling him that he should go to Mayo Clinic in Jacksonville. But his Medicare Advantage plan didn't give him access. Mayo Clinic wouldn't accept his plan. And here's the tough part. When he turned 65, no one really walked him through Medigap as an option. And now, years later, because of his health, he couldn't switch. It wasn't that they made a bad decision. It was just that they didn't have all the facts. And so they ended up getting a plan that really didn't match their situation anymore. But now that his health had changed, he couldn't change. And so now they had limited options to be able to adjust, and limited options for him to be able to get the care that he so desperately needed. So it's not just about what works today. It's about what happens when something changes. Write me if you've ever heard of a situation like that. Let me give you another example. I recently spoke with a lady who called the office about her mom. She wasn't a client, but she'd been referred to me for help. Her mom, here in Florida, she lived in New Jersey, was being treated by a large medical group. You know, one of those ones that has everything under the same roof, the primary care, the pharmacy, even specialists. And they had diagnosed her mom with early stage dementia and had prescribed medicine for it. The mom didn't understand. She just went along with it. You know, she trusted the people in the white coats. But the daughter didn't agree. And she wanted her mom to be able to get a second opinion. The challenge? The practice wasn't willing to write a referral to a specialist who was outside of their physician's group. And the neurologist that they really wanted to see didn't accept their Medicare Advantage plan. So she wanted to get her mom on a supplemental plan during the Medicare Advantage open enrollment period that just ended in March. The problem was because that diagnosis was already in the system, her mom couldn't answer the health questions. And as a result, she no longer qualified medically to switch to a Medicare supplement plan that would have given her the flexibility to see any Medicare doctor anywhere in the country. So again, nothing was wrong at the beginning, but the structure of the plan and the timing of the decision really mattered later on when things changed. So let me say this clearly. If you're someone who chose a Medicare supplement plan, this is the kind of scenario that the Medicare supplement plan is designed for. Flexibility, access, far fewer restrictions to navigate when things change or when you have a serious health issue. So if you made that decision and you've got a Medicare supplement plan, you should feel very, very good about it. The real question as you're choosing a plan isn't, will this work for today? It's, will this plan still work months or even years later when I need it? And that's a question too many people don't ask when they're enrolling in Medicare. Write value in the comments if this is helping you to see things a little differently. So if this is opening your eyes a little bit, well, that's the goal. It's not about fear. It's about giving you perspective. And remember, Medicare is not one size fits all. And there's no single best plan for everybody. Your situation is unique. Your priorities are unique. And your coverage needs are unique. Your lifestyle, your goals, all that is unique. So what works for your friend or what works for your neighbor is not necessarily going to be the same solution for you. And that's where real planning comes in. And you've heard me talk about having a Medicare strategy. Well, that's where having a real Medicare strategy that ties into your overall retirement strategy really matters. And that's what I do for you as your Medicare co-pilot. And the reason I'm the co-pilot is because you're the pilot. It's your journey. I'm just here to guide you and help make sure that you stay on track and that you avoid bad weather and turbulence along the way. And so I'm here to help you think this through and really help you make a decision that holds up over time. If you'd like help, I'd be honored to work with you. You can go to medicarequotes.com/Facebook to book a short Medicare planning call with me. You can also call the office directly, 954-970-4760, or simply drop help in the comments and I'll reach out to you. So here are some common questions that I get from time to time. Can I switch plans later if something changes? Or can I get an Advantage plan now and switch later? A couple of variations of the same question. Well, it's more of a maybe. I mean, yes, you might be able to. If you're on an Advantage plan, you're generally limited to one of the two enrollment periods every year. The annual election period in the fall, October 15th to December 7th, and then the Medicare Advantage open enrollment period that runs from January 1st through March 31st. After that, we're in what's called a lock-in period, which means you can't make any changes. Now, of course, if you move, like you have an Advantage plan, you move from one state to another or from one county to another county and it's considered a move out of the service area, yes, you might get another opportunity. Of course, if you already have Medigap, you can change plans or carriers, but you may have to answer all the medical questions. How do I know if my current plan will hold up? That's a great question, and that's the type of question you really want to be asking as you're signing up for Medicare. If you have an Advantage plan, you're going to need to review your plan every single year and make sure it still works. Those plans can change every year because they're one-year contracts with Medicare, so that means the benefits can change, the out-of-pocket costs can change, the plan can even go away completely. A lot of time the changes occur under the hood, so the plan might have the same plan name, may still be zero premium or very low premium, maybe zero copay for the doctor. The specialist copay might not look so bad, but when you look under the hood, you're going to be surprised to find out that there's a daily copay for a hospital stay, somewhere around $500 a day for the first 5 to 10 days on average. Every plan's going to be a little different, but that's a good average. A lot of people don't realize that, and that can be really expensive if they go in the hospital. A couple $100 for outpatient care, an MRI, a CAT scan, an outpatient surgery, colonoscopy, things like that. And maximum out-of-pocket limits in the networks that can be between $5,000 and $7,000 for the year. That's the amount you have to pay out of pocket before that plan will fully cover you. And it can be even higher if it's a plan that has out-of-network benefits. Medicare supplement plans, on the other hand, those are permanent plans. So that means as long as you pay your premiums, your coverage remains in force and your benefits will not change. And by the way, they can't drop you just because you have claims. Should I change my Medicare supplement plan if my premiums go up? Well, that's a great question. One thing I can guarantee is that all Medicare supplement premiums will go up. And That's why it's so important when you're choosing a plan, because again, those plans are standardized, right? Plan G is Plan G, Plan N is Plan N, but the companies are anything but standard. And that's why it's so important when you're choosing a plan to make sure you're choosing a plan from a company that focuses on stable premiums over time rather than just choosing the company that has the absolute lowest rate. There's other factors that you should look into as well, such as their financial ratings, how quickly they pay claims, customer service. But the key thing you want to look at is you want a company that's been in the market for a long time with a long history and that has a history of stable premiums over time. A good agent or broker is going to have access to that market data, and they're going to use that data to help you find the plan that you want from a company that's built for the long haul. That's something I do for each and every client that I work with. So the key takeaway from today is this: timing matters. When you first start Medicare, all your options are on the table, but that can change later on. When you first start Medicare, it's kind of like an interview process, right? When you first start Medicare, you're interviewing Medicare, you're the one that gets to make the decisions. But later on, Medicare starts interviewing you. And that means that certain options might not be available. It may be a lot more difficult or even impossible to switch. Coverage structure matters a lot more than you realize. Certain plans don't travel well. They limit the providers that you'll be able to see, or they have out-of-pocket costs that can add up substantially when you have a serious health scare. And it's important to look not just at what works today, but what's going to meet your needs, protect your retirement savings, and your medical freedom for the long term. Thanks for joining me today for this week's Coffee with Casey. If you're already on Medicare and maybe you've got a supplemental plan and everything feels fine, then that's great. And today's conversation should give you an even better understanding of why that's the case. And if you're still making your decision, this is exactly the kind of perspective that should help you get it right the first time. If you'd like help, just drop help in the comments or go to medicarequotes.com/Facebook. You can book a short call with me or call my office, 954-970-4760. And if you know someone who's trying to figure this out, this would be a great one to share with them too. And by the way, if you missed our last couple of trainings, you can just drop a replay in the comments and I'll send you the links to the recordings. So thanks again for joining me. I'll see you next Wednesday at 3 p.m. Eastern Time for Coffee with Casey. Have a great day, everybody.